Welcome to the OSHA Bloodborne Pathogens training. Today, we'll review the critical information you need to protect yourself and others from exposure to infectious materials. Bloodborne pathogens, such as hepatitis B, hepatitis C, and HIV, are microorganisms in human blood capable of causing serious disease. Understanding how exposure happens and how to prevent it is essential for every employee. This training is based on OSHA Standard 1910.1030, which outlines the employer's responsibility to reduce or eliminate occupational exposure to bloodborne pathogens. Our department must meet these regulatory requirements to maintain a safe and compliant workplace. During this session, we'll focus on 5 core areas: the OSHA standard itself, epidemiology, the written exposure control plan, required methods of compliance, and record-keeping responsibilities. Each topic is essential to maintaining safety and readiness. OSHA 1910.1030 provides detailed guidance on exposure control plans, compliance methods, vaccinations, post-exposure processes, communication of hazards, and proper record-keeping. Today, we will break down each of these components so you know exactly what is expected. Every employer must maintain a written exposure control plan. This plan identifies how we eliminate or minimize employee exposure. It includes exposure determinations, job classifications, and tasks where exposure may occur. The plan clearly outlines methods of implementation and must be reviewed and updated regularly. Universal precautions apply at all times. Treat all human blood and body fluids as if they are known to be infectious. If it's wet and it's not yours, don't touch it. This mindset is the foundation of preventing exposure. Engineering controls reduce hazards by isolating or removing them, such as safer needles, sharps containers, or hand-washing stations. Work practice controls rely on what employees do, like not recapping needles, washing hands, and avoiding eating or drinking in contamination risk areas. Engineering controls come first. PPE is the last line of defense. Personal protective equipment is used when engineering and work practice controls do not fully eliminate exposure risk. PPE must be readily available and appropriate for the task. Employers must ensure PPE is repaired, replaced, cleaned, and disposed of according to OSHA requirements. A clean and sanitary worksite is non-negotiable. Decontaminate surfaces as soon as possible using a 1 to 10 bleach solution. Never handle broken glass with your hands. Use a broom and dustpan. Dispose of regulated waste in sharps containers or properly labeled bags, and follow procedures for contaminated laundry. All employees with occupational exposure must be offered the hepatitis B vaccine series at no cost within 10 days of assignment. This 3-shot series is safe and effective. Employees may decline, but may choose to receive it later. Booster shots are provided when medically indicated. If exposure occurs, immediate documentation and evaluation are required. The source individual is tested when possible, and the exposed employee receives appropriate testing, treatment, and counseling. These steps help prevent infection and ensure proper medical care. Exposure and medical records must be maintained securely and remain confidential. These include vaccination records, testing results, and medical opinions. They must be kept for the duration of employment, plus an additional 30 years, as required by OSHA. All regulated waste and contaminated materials must be clearly labeled. Look for fluorescent orange, orange-red, or red containers and bags. These visual warnings alert employees to the presence of infectious materials. Bloodborne pathogens training is required at the start of employment and annually thereafter. Training must be interactive. Employees must have the opportunity to ask questions to a qualified trainer. Documentation of this training is mandatory. Bloodborne diseases such as HIV, hepatitis B, hepatitis C, and viral hemorrhagic fevers have varying levels of risk and modes of transmission. Some diseases, like West Nile virus or malaria, are technically present in blood but are transmitted through vectors like insects. Because it is impossible to know what pathogens may be present, standard practice treats all blood and body fluids as potentially infectious. We will now take a closer look at hepatitis viruses, HIV, and several other diseases relevant to occupational exposure. Hepatitis B causes inflammation of the liver and is highly infectious, 50 to 100 times more contagious than HIV. The virus can survive outside the body for up to 7 days. Many people show no symptoms until serious liver damage occurs. Although there is no cure for acute infection, antiviral medications can manage chronic disease. The good news: the vaccine is safe, effective, and prevents infection. Chronic hepatitis B can lead to cirrhosis, liver disease, and liver cancer. The good news is that most healthy adults, about 90%, clear the virus naturally within 6 months. Vaccination continues to be the best protection. Hepatitis C is the most common bloodborne infection in the United States. Most people show no symptoms until significant liver damage has occurred. The virus can survive outside the body for up to 4 days. There is no vaccine, and many acute infections become chronic. Long-term effects mirror those of hepatitis B, including cirrhosis, liver disease, and cancer. Approximately 15 to 25% of individuals naturally clear the virus without treatment. HIV weakens the immune system and can lead to AIDS. While the virus cannot survive longer than a few seconds outside the body, blood exposures still pose risk. There is no cure, but antiviral therapy can manage chronic infection and prolong life. The long-term progression of untreated HIV results in AIDS, a life-threatening condition where the body can no longer fight infections. Other infectious diseases can also be transmitted through blood or body fluids, including Ebola, West Nile virus, dengue fever, malaria, and hepatitis A. Although risks vary, the prevention strategies outlined in this training reduce exposure to all these pathogens. Symptoms of bloodborne infections can include fever, fatigue, nausea, vomiting, abdominal pain, grey stool, joint pain, loss of appetite, and jaundice. Many infected individuals may show no symptoms for months or years. Transmission primarily occurs through contact with infected blood or body fluids. This includes sexual contact, childbirth, sharing needles, and occupational exposures such as needle sticks or cuts. Other potential transmission routes include household contact with infected individuals, tattoos, hemodialysis, prior medical procedures, and occupational tasks performed by nurses, EMS, and other responders. Horry County maintains a written exposure control plan identified in Chapter 5 of the Safety Policy. It details our medical provider, program coordinator, definitions, symptoms, transmission routes, and protective measures to reduce bloodborne pathogen exposure. Our departments identify job classifications where all or some employees may be exposed to bloodborne pathogens. Tasks with the highest risk are evaluated, and required protective equipment is assigned for each task. To reduce exposure, follow universal precautions, rely on engineering controls such as safety syringes and tongs, use proper work practices, wash your hands frequently, and wear PPE as required. Remember, if it isn't yours, don't touch it. PPE must always be available, properly stored, worn when required, and maintained in accordance with OSHA standards. Use PPE exactly as prescribed. This is mandated by law. The hepatitis B vaccine is available at no cost for employees with occupational exposure. It consists of 3 shots over 6 months and is approximately 95% effective. Employees may undergo titer testing to confirm immunity. All needles must be treated as contaminated. Dispose of them immediately in a sharps container or a rigid temporary container such as an empty soda bottle. Never remove needles from syringes. Report all sharps injuries immediately to risk management. There are 4 routes through which pathogens can enter the body: absorption, inhalation, injection, and ingestion. Understanding these helps you recognize and avoid potential exposure risks. Exposure to substances like feces, saliva, urine, tears, and sweat does not typically transmit HIV, HBV, or HCV unless visible blood is present. If exposed, wash the affected area thoroughly with soap and water. Flush mucous membranes immediately with large amounts of water. If an exposure occurs, wash the area immediately and report it to your supervisor. The supervisor must notify Novant Health Urgent Care and the infectious control nurse for guidance on next steps. Risk management must also be contacted immediately. A medical provider will evaluate the employee, determine treatment, and provide a written opinion to the employer. Follow-up may include testing and additional care as required. Any questions? Please contact Training Division via email at hcpd training@recountyisc.gov. Y'all be safe out there.